Hey guys, I thought I'd do another Get Ready with Me. I had a lot of fun doing my last one, even if it wasn't the most polished, and it ended up being a little bit too long. So I'm going to try to be more concise in this one, which is not easy for me. But I wanted to talk about a topic that's super important, and that is how to define success in treatment, in treating TMJ problems. So on my social media, you've probably seen that I usually say that I have a 90% success rate. So what does that mean? It's the 10%, when do I see that I don't have a lot of success with my treatment, etc. So 90% success. So I define success as either drastically diminished or eliminated symptoms. So what does that mean? So if you are coming to me with daily headaches that can vary from a 6 to 9 out of 10 pain level, with 10 being the highest, I define success as bringing those headaches down to less frequent, less severe, or completely gone. So less frequent, less severe, that means maybe once a month, and it's definitely not as severe, so it's maybe like a 2 or 3 out of 10, or just completely gone. So to me, that is success. You're not having daily headaches anymore. You're not trying to live, work, do your daily tasks with chronic head pain. So to me, that means success. What does that mean if your jaw is locked closed, a very painful condition during which you can barely open maybe 1 or 2 finger widths? When your jaw is locked closed, I define success as being able to get you unlocked. So that means you're back to close to your full range of motion. You don't have pain with chewing, yawning, or at rest, or with speaking, and you can sort of eat your favorite foods. And that's really important. A lot of people enjoy steak or salad or bagels. And once the jaw has locked closed, it's very hard, if not impossible, to eat those favorite foods. Let's move on to ear-related symptoms. So I see a lot of people with ear pain and stuffy ears, and I want the ear pain gone. That means you're not having it at all anymore. That's how I define success. And I usually see that happen. It's gone. With stuffy ears, that's kind of the tricky one. If your ears are constantly stuffy, they feel congested like you've been in an airplane or underwater, I typically have an 80% success rate with that one. Now that's just sort of a tricky symptom, and it can come along with other disorders, and it may not necessarily be caused by only TMJ problems. And I believe that that's why my success rate with that one is not as high. Dizziness. I usually see dizziness go down pretty drastically within a month or 2. Tinnitus. Tinnitus is definitely the joker in the deck, and that is what my mentor always told me. I've never actually made tinnitus worse, knock on wood, but I have made it go away or go down. But most of the time, tinnitus does not change throughout treatment. So that is the one symptom that just does not respond predictably at all to treatment. So I never, ever, ever, I'm very careful to never guarantee relief from tinnitus. I know it can be super bothersome and very, very annoying, but I'm always careful to say that I'm not quite sure how that's going to react as we move through treatment, because tinnitus can also be caused by multiple things. Now let's move on to clicking and popping noises in the jaw joints. Clicking and popping noises, if they've been there for many, many, many years, like you've had clicking and popping in your jaw for 5 years or longer, or it's always been clicking and popping as long as you can remember it, I cannot magically make that go away. But I can soften it, decrease it a bit, and I can definitely prevent the clicking and popping from progressing to the jaw locking closed. So that's always a plus. If the clicking and popping started, say, last month, sort of out of nowhere, then there's a good chance that we can get you back to where you were with no clicking and popping. So I hope that helps to clarify what I mean when I say that I have a 90% success rate. I am able to help many people, but I cannot help everyone, unfortunately. I truly wish I could. And TMJD can be difficult to diagnose. It can be difficult to treat. It can be related to your hips. It can be related to your spine. It can be related to just your neck, your cervical spine. It can be related to so many different things. And if the causative factors are super complex, or there's just so many of them, it can be harder to get treatment resolution. It can be harder to see results. Additionally, it's not like a one-stop shop. Seeing you once or twice, I'm not going to get you the best results. Most of my patients are in treatment anywhere from 4 months to 8 months. And in that time, I see them either weekly or every 2 weeks or every 3 weeks, depending on the severity of the condition. At those appointments, we do some very hands-on therapy. It's a type of therapy called craniofacial therapy, where we loosen up the muscles in the head, neck, and jaw. We manipulate the jaw a certain way. We do myofascial release. There's some craniosacral therapy, osteopathic principles, a lot of different things thrown in there. And at the end of those appointments, we actually check and adjust the orthotics, because the orthotics cannot change, but you can. Every individual can. And we have to adjust the orthotics to keep up with your body's changes. So coming here, getting the orthotics, leaving and never seeing me again, you're not going to get the same results as somebody who goes through the whole program. those are the people I typically see a 90% success rate with. So many people want to travel to come see me. They want to just see me a few times. And I just cannot guarantee the same results with that. I never encourage anybody to move here or change their life because of me. But I'm also very, very honest about the fact that I'm just not going to get the same results if I can't see you frequently. And so that's just sort of how it works. So if you are thinking to come see me, please keep those things that I just said in mind. They are super important. I don't want to give anybody false hope. I do have a high success rate. I think 90% is high. If you wear the orthotics that I make you, if you come in for the frequent therapy and the frequent orthotic adjustments, there's a lot that goes with it. And sometimes we do have to get other body workers involved, whether that's an upper cervical chiropractor or a PRI, Postural Restoration Institute physical therapist. There can be a lot that goes into this. And so that's why I just wanted to really get on here and clarify just what works, what doesn't work, why, how I define success. So I hope that this video gave you guys some clarity. Thanks for watching, and be sure to follow, save, and I'll see you all soon.